okay? Every time I feel that, my left ventricle is pumping out that blood to the system. I better have a good pump, right? Because if it's not pumping that blood around, I don't have life, right? Okay, we need the tubing, which is our vessel. That's what's going to take the blood flow around, and we need the blood to actually go around and carry that oxygen and take away waste. These all work interdependently. What does that mean? What does working interdependently mean? Say again? She said one depends on another. You got it, okay? And they all work together. When one of these systems perhaps fails a little bit, the others kind of take up the slack, okay? They can't do it forever, okay? These are compensatory mechanisms that you'll learn throughout the program. And what's neat about this lecture is you guys are on all different levels, but we're learning the main concept of perfusion. So if there's some content in here that you don't understand, you'll either eventually get it, or hopefully I could clarify that for you enough to be able to understand why it's important with perfusion, okay? Okay, so they all depend on each other, and if one starts to fail, the other one's going to pick up the slack a little bit. So when I'm looking at this, there are some modifiable risk factors. You like that little bobblehead? That's me. Yes, 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 yes. Okay, so modifiable risk factors. Smoking. We know that smoking leads to vasoconstriction, right? Okay, so, and with vasoconstriction, that can inhibit perfusion. Lots of smokers tend to lose their digits and their toes because of that vasoconstriction, right? Does anybody smoke while they go to nursing school? Right. But I quit as soon as I graduated. So, yeah. Okay, so that does that is a modifiable risk factor. And even being around secondhand smoke, okay? You think, well, I don't smoke, I'm good. But perhaps somebody in your household does and smokes around you, same effect, okay? Elevated serum lipids certainly would do that. Obesity leading to diabetes, leading to atherosclerosis, okay? Diabetes is so controllable, but if we don't manage our diabetes, it can kill you, okay? Our body does not like those elevated glucose levels. It can do all sorts of things. And you know, if your sugar gets too high, it stuns your neutrophils. Do we know what the neutrophils are? What are our neutrophils? Say it again? Okay, our immune system. Yes, white blood cells. So if our sugar gets too high, it stuns our immune system, so we're at risk for an infection now. So elevated sugars can be so bad. Really low sugars can be bad too, right? Because isn't it true that every cell in our body needs sugar to function? Okay. So, and hypertension, which it puts a lot of pressure on that heart. So these things are modifiable risk factors. And then certainly we have the non-modifiable. Can't do nothing about your age. I swear I'm 29. I've been 29 for about 20 years, okay? So nothing I could do about my age. And genetics too. If you have heart disease in your family or coronary artery disease, you know, you may be at risk for that as well. And same with cancers too, so you can't change your genetics. So those are the non-modifiable risk factors. So what's important is to be able to recognize when a person has a problem with perfusion. So let me give you an example. I have a rubber band around my wrist. How many times have you seen your children with rubber bands around the wrist? Like, take it off, take it off. Well, if I make this pretty darn tight, that's really tight, what's going to happen to my hand?
It's going to cut off the circulation.
Okay, what's it going to look like?
It's going to get purple and sweat.
And then what's going to happen?
It's going to fall off.
It's going to fall off. She's right, okay? Because I can feel it now. I'm already losing blood circulation to my hand. It's starting to tingle, okay? So I am losing circulation to that hand. How do I fix it?
Take the rubber band off.
Take the rubber band off. Absolutely. Restore that perfusion. I don't think I can get it off now. So, and what she was saying, thank you very much, is look at that, okay? How would you, if you went in to assess your patient, what would you call this? Cyanosis, okay? It's that blue or purpley color, even sometimes gray. Cyanosis is a late sign. You go into your patient's room and see a cyanosis, uh-oh, okay? You better do something fast, okay, because there's a lack of perfusion there. So there's different things that can cause lack of perfusion to, say, one arm, okay, or one limb. As you saw, it was the rubber band for me. But as nurses, we need to make sure we're monitoring all of our patients' extremities. Okay, this one up here, or down here rather, this one. This is an infiltrated IV site. Whoops, okay? So we cannulated the vein, and for whatever reason, maybe the vein ruptured or it got dislodged. So now all that fluid that was once going into that patient's circulatory system is now going into the tissue. There's only so much space in there that it can handle. So you start getting this real puffy looking type limb. What can you do about that? Say it again? Drain it? Well, how do you drain it? How do you drain the tissue? That's a very good guess. She said diuretic. Diuretic works on the vascular system, not the tissue. Okay, that was a good guess though, because she's on the right track.
Elevation?
Certainly you could do that as a nursing measure, elevate it, absolutely elevate it. But maybe it might get so bad that the patient loses circulation. So elevating it, it's not gonna help, right? You have to restore circulation. Now if you guys, you all took anatomy, right? I'm gonna go back to anatomy class. You have to remember anatomy, yes. Okay, so remember that when you were learning and you were dissecting your cat, right? Your cat had this substance around it called fascia, okay? Or as my teacher used to say, fascia. It's the fascia. What the fascia is, it's like saran wrap that's completely around the body, and it kind of keeps everything tucked and nice, okay? What they would do in this situation is they would remove some of that fascia. This person would have a fasciotomy to remove some of it, to allow that swelling to happen and stop compressing on that vessel that's given me that pulse, okay? So that's an extreme case. I've seen it a lot in my practice, okay? Certain things, any kind of edema, a broken leg, let's say it swells up so bad where the circulation is impaired, that needs to be rather quick. And with good assessment skills of doing neurovascular checks, you could pick up on that lack of perfusion. So and that's how you would fix that situation. What about this one up here in the left-hand corner? What would you call that? That is necrotic, okay? That is called necrotic, and sometimes it's called eschar, okay? And what that is dead tissue, okay? How does that happen? Say it again?
I was just gonna say the perfusion never came back.
Right,
Wasn't fixed.
right. Perhaps this person, she said the perfusion was never fixed. This person could perhaps had a wound that never really healed. Maybe they're diabetic and their sugar is elevated. Well, isn't that a fight or flight response? Elevated sugar? Your liver's gonna say, you're gonna fight this. You are gonna win too. I'm gonna give you all this sugar, all this sugar. And actually it's hurting us, right? It's stunning our immune system. So we're at risk for infection. Perhaps that's what happened to that person. Or perhaps they have such bad perfusion to that limb that the area got necrotic. It absolutely happened. Okay, so as I was saying, neurovascular assessment, you are to do this on every single patient all the time, okay? I've had students in the past say, yep, good pulse, it is good pulse. I'm like, really? Because their right arm just fell off, because you didn't check the right arm. So when you're checking for, say, a pulse, you want to check the apical, and then you could check the left and right. But you don't have to count your heartbeat here, count your heartbeat here, count your heartbeat here, count your heartbeat here, and so on and so forth. You're checking for symmetry at that point. Radial pulses, popliteal pulses, pedal pulses, posterior tibial pulses, okay? But isn't it true if we have a pedal pulse, then we would have that popliteal pulse? Because it kind of wraps around that same vessel? Okay. So, but it's very important to assess this, and I call it the 5 Ps, and you've probably seen this before. So when you're assessing a patient's limb, first thing is pain. Now when I had that rubber band wrapped around my arm, it started to hurt a little bit, because I felt it like kind of tingling, okay? So a patient may experience pain, and that's what you're gonna ask them. Paralysis, you can't move it, okay? You're gonna assess that. And then there's paresthesia. Do you feel this? Do you feel the sensation? Did anybody ever sit on their leg and they get up and it's needles and you're like, ah? That's the blood perfusion going back into the leg. That's quite painful. So, because you probably had it so numb, there was no circulation going there. So don't ever sit on your legs. Okay. And pulse. Was she sitting on her leg?
Yeah.
Okay. Don't sit on your legs.
Well, I won't now. I'm terrified. Thanks.
Are you feeling
Okay. You feel the tingling?
A little bit.
So pulse. Certainly you want to check for capillary refill. What is normal?
1 to 2 seconds.
Less than what? Less than 2 seconds. Some books say less than 3 seconds. Very good. Okay. And pallor. What's that? Look at me. You'll see pallor. I have no color to me. Right? I'm very, very pale. So it is. It's absence of color, loss of color. Pale. Okay. So those are the signs that you want to check when you check the left radial, the right radial, and so on and so forth. Okay. That's how you do your neurovascular assessment. That's a great way to establish perfusion. Okay. So now this is an example of what's called modeling. Now you'll notice that the legs look different. The one on the left looks normal, correct? The one on the right, you see it has all those little kind of blotchy areas, okay? Now if somebody is truly modeling, has anybody ever heard that term before? Okay. A lot of times patients who are near death are starting to model, okay? And if you pull the covers down on your patient and you see their legs looking like that one on the right, that's not a good sign. Or I've often seen it if you have a really skinny friend, like I do, and they go out in the cold and they come in and they're like this, and their arms are all looking like that, that's kind of modeling. In that case, it's just they're so clamped down, they're vasoconstricted because they're cold. It's trying to preserve heat. In this case, you wouldn't have modeling in one leg. Okay, but this is to show you a side-by-side comparison. So this is poor perfusion to that leg. If you do see it in one leg, perhaps this person has a clot in that leg and there's no circulation. It's an arterial clot. There's no circulation going through that leg. Not a good thing, but you would pick that up when you're doing your neurovascular assessment, okay? Okay, now this is a little graphic and I'm sorry, but you probably have already seen this before, right? Okay. So this is a necrotic toe, and we typically see this a lot of times on our patients who have heart disease, diabetes, all those comorbidities that will decrease your perfusion. What do you think they do for this? Yes, they take the foot off. They take the toe off. Well, they start with the toe, and it starts to work its way down. So it's really important to make sure you're establishing some kind of perfusion. If you go to me, if we're in clinical and you say, oh, Lisa, I didn't feel a pulse on the left side, but the right side's pretty good. That's not an acceptable answer, okay? We have to find a pulse, or we need to go notify a physician right away, okay? They should have bilateral pulses. So, and that's something you're probably doing now, okay, if that's happened to you. Okay, diabetic foot ulcer. How do you think this is caused? And if you need me to send you this PowerPoint, I see you taking pictures, I certainly will. Just send me your an email and I will send it to anybody, okay? I'll give you my email at the end. So diabetic foot ulcer.
Because you get neuropathy, so they may not feel anything.
They don't, yeah. Diabetes, again, sorry, it destroys perfusion among other things, okay? So again, this may not ever heal, and if it does heal, it's going to take a long, long time. So, and we look at patients when we're inspecting their heels, the bottom of their feet, they might not even know it's there, okay? So, as a result of poor perfusion. Okay. Okay, so this is where we get our little flashcards, okay? So please don't yell out the answer. So it looks like a majority, it looks like all of you said day 1A. Okay,